Yes, you know it. It was written and it was promised. He is risen indeed. Beyond our belief in the resurrection of Christ, nothing else can exist. So why on earth would you seek the living amongst the dead? Yes, me Nortey by nature. Let's give some praise, huh? Yeah, we are reborn, resurrected, revitalized. Ultimate Health on Joy 99.7 FM. What better day to play Hosanna? In the spirit. By nature, huh? Yeah, we're justified. We can celebrate and sing Hosanna. Live on Facebook and YouTube. It's called Ultimate Health, your ultimate guide to healthy living. This and every Sunday, 2:05, by His grace.
Hosanna.
So we're still in business, talking about resurrections, rebirths, restorations. Yeah, we continue our tale. Today I've got Dr. Michael McCarthy in the studio. Yeah, we did something wonderful, huh? We considered the medical miracle and wonder of multiple pregnancies. Yes, twins.
You know it's another OPK classic.
And beyond, of course. He's agreed to be with us this Sunday, this special Sunday. We're talking about managing multiple births, twins, triplets, and beyond. Yeah, some really overdo it, right? By grace. So what's involved? What are the complications? What are the specific management concerns, strategies required when you are carrying multiple pregnancies and indeed you proceed successfully to give birth? So tell a friend to tell a friend. We're live on Facebook, YouTube, Ultimate Health on Joy 99.7 FM. I've got Dr. Michael McCarthy in the studio. Doc, great to have you.
Nice to be here.
Yeah, happy Easter to you.
Christ is risen.
He is risen indeed. And resurrection. I mean, if you don't believe in the resurrection, everything else that has been written really doesn't add up. Has no basis.
That's so true.
Yeah.
That's so true.
Right. And we're back in your territory. Resurrection, rebirth, birth. It's all phenomenal. And I've been reading like I always do. And it's so fascinating, this whole area of multiple pregnancies. And indeed, we pray that most of them do proceed to multiple births. I've seen terms like multiple gestation and so many other things, right? But we did consider this, and we explained to our discerning listeners what happens when one fertilized egg in its development breaks into two or more, and we can get monozygotic twins. We learned about two eggs being fertilized. Then we have the dizygotic and all that.
Exactly.
And we went into all the intricacies of multiple pregnancies. I'm assuming that our listeners are pregnant with all that information, and we can proceed, right, to look at and consider multiple births. But let me just start by, going back. So a woman is carrying multiple pregnancies. You raised some of the concerns during the last program. Can we just go over them? We did label them, with your permission and guidance, as high risk or pregnancies of concern. Can we just go over some of those quickly, and then we'll look at the...
Yes, exactly. This is really an exciting topic from medical point of view and also from the social point of view.
It's a pregnant topic.
It has a lot of facets.
It will deliver.
The complications and the problems could be classified as those occurring during the pregnancy period, those occurring during the delivery period, and then for the babies, those occurring, and also for the mom, of course, occurring after the delivery. And different things are happening in these different spaces, which would be a little different from what would happen with a woman carrying a single baby. So we're kind of comparing single to multiple, and there are differences in these. So in the antepartum period, that is before the labor or before the delivery time, the differences have to do with close monitoring, because multiple gestations have a worse outcome than single pregnancies, and so the monitoring must be different. Because the risk of preterm delivery, shortening of the cervix, preterm contractions, abnormalities in the growth of the baby, the amniotic fluid, placental issues, and so on and so forth. All those things are going on. And then during the birth process, the delivery or the labor or the time, the labor ward and so on too, it becomes more complex, because now you have two passengers waiting to alight.
Two or more.
Yes, two or more passengers waiting to alight. And so, who is coming first? how is the
How are
first
they
one
coming?
positioned,
Yeah.
who is coming second, and how are things happening? Are we well positioned? Are we strong enough? Is there
Right.
something in the way? Are there complications? Where is the placenta? Are we sharing a placenta? And
Okay.
so on and so forth.
Great.
And then also comes the increased risk of bleeding
Right.
after delivery, because of the fact of the multiple pregnancy. And then afterwards also the babies have more challenges, because there's a higher risk of malformations, there's a higher risk of being low birth weight,
Right.
and fetal distress and things like that. So
Okay.
a lot of
A lot of
increased
things.
risk of problems here.
Right, 14 minutes past the hour of 2, and Doc is telling us the menu is pregnant, right? So many
Yes.
issues. You have to be critically monitored if you're carrying multiple pregnancies. You must be critically monitored. And Doc, let's quickly, with your permission, already you've given birth to about 4 more programs down the line. If I look at the time now and the issues we've outlined, it's very, very important that we consider each of them. But a woman, let me just ask this, a woman who's carrying multiple pregnancies, does she need to gain more weight? Does she need to eat more? Does she need to present more frequently for antenatal and so on and so forth? Can we look at some of these things? I mean, you're carrying, by God's grace, multiple pregnancies, okay? I'm assuming at this stage where they are considered to be viable or healthy, right? What do you walk around like anybody else? I mean, do you eat for 3, 4, 5? I mean, what do you do? What should the woman who is carrying this pregnancy, with all these people waiting to alight at the bus stops?
Yeah, you've brought in a very important thing, and,
Yeah.
and that has to do with nutrition.
Right.
You know, the nutrition is very important. It starts even at the early stage. So somebody with multiple pregnancy may start getting pregnancy symptoms earlier
All right.
than the person who is carrying one. And
Okay.
if these pregnancy symptoms happen to be not feeling like eating, anorexia,
Okay.
or severe nausea or persistent vomiting, already your nutrition starts to be compromised, because you don't feel like eating. You
Okay.
just want to eat one kind of thing, so you're not getting the nutrients and so on. So already right from the beginning, you are disadvantaged as far as your nutrition is concerned.
Okay.
So the nutrition aspect is really important, how we can manage it right from the beginning.
Right.
The other thing about this is also that the demand placed on the mother's body is more,
Right.
because now you have 2 people or more who are competing for the nutrients that the mother has
I
to
hope
give.
the gentlemen are listening, right?
Oh, the men are usually extremely supportive.
Okay.
I mean, in my practice, the men are fantastic.
Okay.
I mean, most of the men are present, are available, are supporting, and so on. And as you said, this is extremely important, because the mother is going through something that is not very easy.
Okay.
It's actually much more difficult than a single pregnancy. And so the nutrition aspect is extremely important in helping and encouraging and so on.
Okay.
I think it's important that for a twin pregnancy, a nutritionist needs to be part of the care of this patient.
Right.
You know, because how do you eat? Okay, look, I can't really eat much. My tummy is distending too much, and they say we should eat more. The nutritionist can come in and say, okay, why don't you eat 6 times a day instead of 3 times a day, and make your meals much smaller?
Right.
So you can tolerate them, but you're doing it more frequently. You're doing it every 3 hours.
Okay.
And so that becomes easier for you to bear, becomes more interesting. You don't get the bloating and the reflux and discomfort from eating and so on. So so immediately you are eating more, but you're not feeling like you're eating more.
Great.
Yes.
18 minutes past the hour 2 on Joy 99.7 FM. If you've just walked in literally, virtually, this is Ultimate Health on Joy 99.7 FM with me, Nortey by nature. Yes, we're talking about managing multiple births, twins, triplets, and beyond. Yeah, I don't know how they do it. I mean, if a woman has 4, and we'll check the team sheet, right? Is it just Dr. McCarthy on his own doing octopus jobs, or is there a broader multidisciplinary team required, right, when we get to the birth? But we're picking up the speed gradually. Yeah, how should you handle yourself? Should you be eating more, looking after yourself more seriously? He's confirmed all that. I forgot to add, right? Dr. Michael McCarthy is a consultant obstetrician and gynecologist. He's the head honcho at Chief Slave at Senior Specialist Family Hospital in Tema Community 6. Right, a very good friend of the program, and those of you who have all these, virtual or distant or vicarious crushes, please, he's married, happily so, right? I get these messages all the time, Charlie Papa, no, how? They feel please, let's be serious, okay? If you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. Yes, Resurrection, Rebirth, and of course, Birth. Okay, so we've understood this, right? Let me talk about the team, and then let me talk about, maybe in my layman's understanding, heightened monitoring, right? Heightened monitoring of the woman and of the fetuses she's carrying, okay? Because it's a multiple pregnancy. So who should be in the team that is managing as we approach, birth or delivery and labor and delivery? Is it the same routine? Is it you see your obstetrician and so on and so forth? Who should be part of this team?
I mean, there are different people involved, and each person is important in their own right. We just mentioned the dietitians, the nutritionists.
Okay.
Extremely important. We have the midwives, who are extremely important as well. Of course, the obstetrician and the other doctors.
Okay.
The people we need to remember also are the pediatricians.
Right.
Because they are going to take care of the babies as they are coming out. As we are planning, these pregnancies usually tend to end before 37 weeks.
Okay.
It could easily end.
There's a high likelihood that you have a preterm
delivery of premature baby. Yes.
Okay.
And so pediatricians are aware of this. They are preparing. I remember we had one recently, and right from 30 weeks the pediatrician was involved.
Right.
Conversations with the mom, you get to know what is going on and what to anticipate. And so when the call comes at night that this is what's going on, this is the emergency, the whole team is prepared.
Right.
We also need to have the psychologists on board.
Right.
Because sometimes it can become quite challenging, how to adjust what is going on and so on. And so talking about the issues that may happen, that look, you may get a preterm delivery. How do you take that?
Okay.
You may have certain significant complications, blood transfusion and so on. So all those things are part. Then we also have the laboratory team that needs to come in. For example, in the nutrition sphere, we need to ensure that we are monitoring the blood levels, because people with multiple gestations are more likely to get anemia.
Right.
Because of heightened demand and the increased usage and so on and so forth, reduced dietary intake of nutrients and so on. So anemia becomes a problem.
All right.
And also ensuring that blood is available for them in case a transfusion is needed and so on. So there are quite a number of different people who may need to come in as and when needed.
So you need to be managing this at the right place, at the right facility, God willing, right? Let me just ask this question before I go on to the monitoring. I'm carrying a multiple pregnancy, all right? I have a place I go to and so on and so forth. But is it more important for me? I guess the question answers itself. But, a lot of women, if they can, will skip the antenatal and the checks and all those kinds of things. Should I be more serious? And is it likely that I'll require more visits for antenatal checks?
Yes. There will be more visits in this case. Some more interventions, some more closer monitoring of the various aspects, the blood, the vital signs, the size of the abdomen, the ultrasound of the babies and so on, checking on the cervix. And so there'll be more frequent checks here. In fact, these pregnancies are considered high risk. So in the health system that we have, they'll be pushed up in the ladder of capacity and capability.
Right.
Yes. So if you're at a certain place where you think that you cannot manage this patient alone, you definitely will move this patient to a higher level with more expertise.
Okay.
And so it automatically happens that as soon as you have a multiple pregnancy, you make sure that they are pushed to the right level in the health system.
Great stuff. 23 minutes past your hour to Ultimate Health on Joy 99.7 FM. We're considering the management of multiple beds. We've got an obstetrician gynecologist in the studio, Dr. Michael McCarthy. Any questions, concerns? WhatsApp is 055 11 11 997. We're live on Facebook and YouTube, and all those platforms hopefully are pregnant with your concerns and questions and experiences. Share with us on Joy 99.7 FM. And let me just remind you, the brand, the station, multimedia, and indeed Joy FM will be sharing time at the Lepers Village, if I can call it that, the Lepers Home, tomorrow. Yeah, we'll be spending time as our observation of our normal Easter soup kitchen. We'll be doing some funky stuff with them there. Indeed, in the weeks to come, I will do a program on Hansen's disease, yes, also known as leprosy, so that all the myths and misinformation will also be dispelled. But currently, we're managing multiple pregnancies. So we've said this, okay? Heightened monitoring. We know you do ultrasounds and all of these things. You check for fetal heartbeat and all these kinds of things. Now it's like a whole orchestra. I mean, how do you monitor all these things? How would you know whose heart is beating and so on and so forth? And how important and critical, indeed maybe non-negotiable, is this heightened vigilance and monitoring?
Well, that's an interesting question. As you know, and pregnant women know that we bring out a tape measure when we are doing our antenatal clinic, to measure the size of the growing uterus. You know, and we try to correlate the growth of the uterus with the gestational age and compare it to the previous reading and see, is this baby doing well? Now, when it comes to twin pregnancy, you are not really sure what you are measuring when you bring out your tape measure. Because you are measuring these two babies together. You're not able to measure them with your tape measure alone, like as a single, or measure them separately on their own merit. You have to measure the entire uterus. Now, you're not sure, are you measuring these babies growing correctly? Are you measuring them, are they growing equally, and so on and so forth? So for twins, you need to go much further than that. You need to use the ultrasound scan, and then you can measure each baby separately. You know, so this heartbeat is on this side, this heartbeat is on the other side. So when you use your other Doppler machines and so on to check on the heart rate, you would know that you are probably measuring the correct one. So your ultrasound for twins is extremely important, so that you can look at the growth of A and look at the growth of B and the others. It takes a bit more time to do an ultrasound scan for multiple pregnancies, because you need to delineate them. Whose head is this? Whose heartbeat is this? And whose body is this? You know? So you need to keep tracking, and that takes a little bit more time, especially if it's more than two. Then it becomes more complicated and difficult. So it takes a bit of time, but that's the important part. So once you measure, you are getting an objective measurement of each of the babies separately, and that is how you diagnose some of the problems, where one is growing more and the other is not growing as much, and then you know that there's that mismatch, which can become a serious problem.
So in all this, of course, the mother's should I say health status and all other things are quite should I say central. If the mother is healthy and so on and so forth, then we expect that the pregnancy will be healthy, but we'll be monitoring all of these should I say simultaneously.
Exactly.
And I guess mom will be getting feedback on all of these processes, or is it just for the the qualified? Do you regularly? I mean, of course, you'd have announced to this woman that you are actually carrying more than one, right?
Yes. No, you need to do that right at the beginning. I mean, this is no secret.
This is no secret.
It's no secret. I mean, if you do a scan early on, and you find twins, you don't say, I'm
Right.
not sure whether it's really twins. Let me keep quiet and let me wait small. No, you tell your patient that,
You
well,
must
this
tell
I'm
them.
seeing
Right.
2 sacs. This may be two babies, or
Okay.
I'm seeing 3 sacs. This may be 3. It doesn't matter. We know
Is it
things.
ever too early to confirm that it's a multiple pregnancy? Do you have to wait for some time for them to show up properly or show that they are stable or whatever?
Yes, sometimes it's not easy to determine at the beginning.
Okay.
And so it's a process.
Right.
So it depends on how early you do your scan. Definitely at the first time the patient comes in, you need to do a scan, and then you know where you are starting from.
Okay.
You may diagnose twin pregnancy immediately. But if it's extremely early, you may not even see a gestational sac. And so then, of course, you cannot say.
Okay.
But if you start seeing the gestational sac, then you can start giving information.
Right.
And in my opinion, you should give the information as you go along.
Okay.
Because things may change. The last time we talked about vanishing twin syndrome.
Right. Okay.
And, well, I mean, the client needs to be part of that journey.
Right.
So that you can give her the information. She can be part of what is going on.
Okay,
Yes.
right. So this is teamwork, right? Your doctor is talking to you throughout. There's a lot of
Yes.
feedback, a lot of stuff for you to integrate and
Yes.
understand whilst preparing. We haven't even gotten to birth or labor yet. I
Yes,
mean, labor
yes.
or birth yet, right? We're taking our time, man. We're about in our second month in this discussion, all right? We haven't gotten anywhere yet. Or I know that's a bit too fast. But interestingly, I know it might derail us a bit, but I wanted to ask, Doc, as a consultant with years of experience alongside your late dad as well, I mean, can a woman say, hey, what did you say? Multiple, I'm not having that. I don't want that. Do you get that kind of a response? Have you ever gotten it? And what would you do with it? I mean, hey, I can't, hey, wait. My budget is this, or my plan was this. You say I have multiple, this is not on. Can you do something for me, Doc?
Yeah, I mean, the responses are varied.
Right.
You have those that are excited to have twins, those that are shocked to have twins,
Right.
and those that are completely averse to having twins.
Right.
But you need to give that information to
Right.
the
Okay.
clients. You need to give them the time to digest the information. You need to get other people involved. One of the important things I've learned over time is that you need to get other people around the patient or the pregnant mother involved. The husband, the mom,
Right.
her
Psychosocial
sister.
support.
Yeah, it depends on who is coming with her to the clinic, you know. And they should be part of it, you see, because sometimes it's a heavy load to carry for the patient, and she needs some support. She needs to, know where she stands and where the important people around her stand, so it becomes, as you said, support within her social and psychological circle. Yes.
Okay. But you haven't had somebody say, no, I'm not having this. Can you delete one? Can you make it easier for me? And so on and so forth. You don't get those kinds of responses.
No, this goes into...
A lot of people believe that you can pick and choose and decide that.
It's not that simple. It's not that simple.
Okay.
But this discussion actually goes more for the IVF multiple pregnancies.
Okay, assisted reproduction.
Yes, where you have a situation where you have more than 2. You have 3, you have 4, you have 5. The reality is that when you start having those numbers, your pregnancy is probably not going to get to viability before the pregnancy ends.
Okay.
And so there is that need at that point
to have that discussion,
to reduce the number of fetuses that are actually present in the uterus. So
okay.
that becomes a complicated discussion, and again, it cannot just be had between the obstetrician and the pregnant mother. It becomes more of other people get involved.
Great stuff. This one from Solomon in Medina. Doc, I want you to ask, not a good afternoon, I want you to ask doctor. My wife is 4 months pregnant and has had hot body temperature since the first month. I have asked for her to find out from the doctor, but she said she is being attended to by a midwife. Is there a problem or is this normal? So his wife is pregnant. He doesn't suggest or indicate that this is a multiple pregnancy, but he's worried about her body temperature. And he says it is hot, or I'll presume high. And he wants this investigated. He asked her to ask her doctor, but he's finding out from her that she's actually being attended to by a midwife. And I guess he's listening to us and wondering, is this okay?
Oh, I think a midwife is perfectly capable and licensed to take care of a 4-month pregnancy.
Okay.
And there's nothing wrong with her being seen by a midwife throughout her pregnancy, depending on what the midwife finds and sees. The midwife knows when she needs to refer her patient to the next level.
Right.
And she will do so if those things come up. Increased body temperature, she definitely will measure the temperature, and if it's beyond a certain level, she will know what to do.
Okay.
We know that there's the perception that the pregnant woman is much hotter. Her body is hot.
Really?
And that's because of the increased progesterone in her system.
Okay.
And the progesterone causes the blood vessels to dilate in the skin, and so there's more blood flowing there.
Right.
And then that gives you the impression that, oh, your skin is warm or your skin is hot. And we know that that's a normal thing that happens in pregnancy. But if we measure the temperature, it will still be within the normal.
Okay. Solomon, I hope that sorts you out and brings down your temperature. It seems quite okay for this to be handled by a midwife, as you describe it. And Doc says the midwife has the requisite training and expertise to refer should anything untoward be happening to your wife and her pregnancy. If you have any questions, concerns, 055 11 11 997. Ultimate Health on Joy 99.7 FM. Managing multiple beds, twins, triplets, and beyond. Doc always says twins. We're limiting it.
Just because they're the commonest. They are the commonest. So not that they are common, but they are the commonest among the things we are discussing.
Right.
The triplets
Great.
are much fewer.
I understand.
Yes.
My listeners will come in with questions. You see the questions are coming in triples and stuff like that. But very, very interesting. Okay. So we have a lot of vigilance, a lot of monitoring. We say it is high concern, very often high risk.
Yes.
There's a high potential that you may not go the full term, and therefore your baby may be preterm or premature. And these are all issues that your obstetrician gynecologist is well abreast with and will be taking decisions alongside or with your understanding and hopefully input as well along the way. If you have any questions at this point, WhatsApp is 055 11 11 997. I'll activate the phone lines now, 030 221 6541. 030 221 6541. We are honored to be speaking to Dr. Michael McCarthy of the Sinal Specialist Family Hospital in Tema Community 6. We're looking at managing multiple pregnancies. You have more than one child, or let me say fetus, growing in you, and we're looking to get into the point where you deliver. Right? Will labor be the same? Who comes first? Are they handing over batons to each other? I've read fascinating things about how long should it take after you deliver the first one before you bring out the next one, and so on and so forth. Fascinating stuff. We'll do what we can do today, and then I'll go. My usual stuff is to beg Doc in the car park next week. How? Because he's a very prayerful man. He doesn't joke with his Sunday and his church, but he's always here for you and I. So make use of him. Somebody's typing, let me say viciously. But Doc, so we've understood this, right? Lots of monitoring. Over time, okay? I'm tempted to ask. Let me ask this one. Of course, people terminate pregnancies, and we know there's a certain, should I say, age of development of the pregnancy beyond which we do not want to touch it. Okay, there are reasons for which you may abort or terminate a pregnancy. Does any of that stuff change because the person may be carrying, albeit in the early stages, a multiple pregnancy? These kind of considerations, if there's any reason to terminate.
No, it's still the same.
It's the same.
Yes, it's still the same. So that would have to be at the very early stage of the pregnancy.
Okay.
Yes.
All right. So still the same there. Okay. So we're moving along steadily. I'm still carrying my multiple pregnancies. I'm fine. I'm being monitored. I'm eating what I'm supposed to, and so on and so forth. We talked about what you eat. I read somewhere, unless I'm mistaken, something about weight gain. That is, should I say, supposed to be within, is it weight gain or something? Is there anything like that that is of concern? How much weight or whatever the woman puts on during the period, during the pregnancy?
Yeah, I mean, weight is extremely important. It's not just weight gain. Some people lose weight
They
during
lose weight
pregnancy.
too, right?
Yes, and as a start, that is a cause for concern. It is more normal to gain weight than to reduce weight. So if you are reducing weight in pregnancy, then that calls for us to check your nutrition, what is going on. Maybe you're throwing up a lot, you're not able to eat, strong aversions, strong nausea. We have to intervene there. Or maybe you're even getting dehydrated. And so that will be a sign that we need to intervene. But weight gain is the more normal part.
Okay.
But you could also gain excessively. But we know that for twins, you probably will gain more weight overall than for the singleton at the end. But if there's a rapid increase in weight from the previous visit to the next visit, then we need to look at other things going on. Are we retaining fluid? Is there an issue of hypertension coming up and those kind of things?
All right, great stuff. Phone line is active 0302216541. Ultimate Health on Joy 99.7 FM. WhatsApp is 05511119997. I do believe we're live and active on Facebook and YouTube. Guest in the studio, Dr. Michael McCarthy. Right. Good afternoon, Nortey. Happy Easter. Please ask for me, what are the causes of a baby dying in the womb before or during labor? Ajiman Joseph, Community 9, a.k.a. Ajingo the man. Unless you want him to go through the whole range of possibilities. Doc, are we able to say or answer this specifically?
Yes. So this is a very important question, especially when we are talking about twins, because sometimes we could actually have in the multiple gestation, we have one of the babies dying in utero, whereas the second one remains alive, and that can be a challenge. Yeah. And that can happen very early, or that could happen much later in the pregnancy.
Right.
And so the cause, as he's bringing out, the cause is extremely important. What is the cause? Why is the baby dying? Is it something limited just to the baby, or is it in the system of the entire the woman's system?
Right.
If it has, so the causes could be from the baby, could be from the placenta.
Okay.
Those are where the issues usually reside.
Okay.
So if it's from the baby, it could be there's a malformation in the baby. Things are not going well in the way the baby is working with itself, in its body, the cardiac or the blood system or something else. Then you have the situation of the placenta. Maybe the placenta is not functioning properly.
Right.
There may be a problem with the umbilical cord, which is transporting the nutrients back and forth, or the placenta not being able to function properly.
Right.
And all these things could actually lead to the baby dying.
Okay.
If it is limited to just one baby, then the other baby is relatively safe.
Okay.
But if it is something that could happen to both sides, both of the babies, then we have a problem.
Right.
More recent, maybe this is relevant, is to talk about COVID-19.
Right.
Because we find out that there is an increased risk of intrauterine fetal death with COVID-19 infection.
Right.
Both an increased risk of miscarriage and an increased risk of intrauterine fetal death.
Okay.
And now both babies here have the similar risk, because the mother is being infected and they are both exposed. And so in this case, both of them can be affected.
Right.
Whereas if it is an isolated placental issue or just on that side, then maybe just one fetus will be affected.
Okie dokie. I have a caller on the line. Hello, good afternoon.
Good afternoon, Doc.
Yes. Where are you calling from and your name, please? Hello? Line's a bit bad. Abiku is sorting that out. He'll indicate when that is okay. Let me read a couple of messages whilst he's doing that. Good afternoon, please. What stage... Scroll. What stage in pregnancy to finally confirm transverse in pregnancy or prevent it? Oh, you see, you went so far ahead that you're typing, right? What do you... transverse relates to the position of the fetus.
I think so.
Right?
I think
and then secondly, what stage is sex good in pregnancy? Kwame, the positioning of the baby, do you need a stage?
The position of the baby is important.
Doc, sorry, the caller is back on the line. Hello?
Hello.
Yes, good afternoon. Your name and where you're calling from, please.
Good afternoon, Doc. My name is Yvonne. I'm calling from Afenia.
Yvonne from Afenia.
Yes, please.
Please share with us.
Okay, Doc. Is it possible for multiple pregnancies to go unnoticed to labor? That's my number one question. And number two, how early or late, are you supposed to experience the Braxton Hicks contraction or whatever it is? Yes.
Okay, so can you guys, the Michael McCarthy's and co's, can you miss this all the way to labor, that a woman is carrying multiple pregnancies and you never spotted it till she's about to deliver, and then she talks about a contraction? What time or what stage does it come?
Right, that's an important question. Yes, you could actually miss a multiple pregnancy all the way through pregnancy. It depends on how the patient is being monitored,
right?
Ultrasounds being done,
right?
Who is examining the baby and so on, the pregnancy and
right.
so on.
Okay.
And so this can be missed.
Okay.
But if you do a detailed ultrasound scan, especially early in the pregnancy, you should be able to find the number of fetuses that one is carrying.
Okay.
And even later on, where it becomes much more complicated, you should still be able to find how many fetuses there are.
Okay.
And so it's quite unusual to have a situation where you would have a very good ultrasound scan being done and you not actually be able to diagnose the number of babies that are in the womb. But it is entirely possible. And in medical literature, you have the issue of the retained second twin,
right? Or
you have the procedures you have to undergo when you do your first delivery to check and make sure that there is no second baby inside as well.
Okay.
So all those procedures are
She
present.
talks about a particular, she named the contraction, Yvonne in Afienya.
Yes, Yvonne mentioned Braxton Hicks contractions,
right,
which are painless contractions of the uterus that occur during pregnancy.
Okay.
Then usually they occur as you move from 20 weeks onwards.
Mm-hmm.
Some people even tell you that they are feeling them much earlier. But it's easier to feel them once the uterus is bigger because you feel the tightness. So, but they are just, let's call them practice contractions.
All right.
Where
testing mic 1 2.
Yes, where the uterus gets hard like a contraction,
right?
But there's actually no pain. There may be that feeling of tightness, but not really pain.
Okay, great. So this confirming the position, whether it's transverse, vertex, or breech, or whatever, that's the question. And it says, what stage can you confirm that and or prevent it? And then secondly, at what stage is sex good? I don't know whether the person is looking for a period or a stage where you would prohibit or discourage sexual intercourse.
No, he's saying good. He's not saying dangerous. He's saying good.
Good. As in
good.
What?
I'm
enjoyable?
not too sure. Maybe enjoyable.
Beneficial?
Or maybe beneficial to the pregnancy.
Hey, Kwame.
It really depends. I mean, generally we don't prohibit or limit sexual intercourse during pregnancy.
Okay.
For pregnancies, unless there are specific things that are happening, and then we will say you should not have sexual intercourse in this pregnancy at this time for so and so duration.
Right.
Could be ruptured membranes, could be bleeding, could be preterm contractions, things like that. So then we'll tell you. But apart from that, you should not have any red light happening there. But we must also take into cognizance whether the mother is comfortable or not.
Right.
Because it's not just a one-sided affair. This is quick. Kwame is a
Kwame
gentleman.
is asking.
Yes, but we also need to ensure that the pregnant woman is comfortable and willing.
Maybe his wife is requesting.
Yes, then that's not a problem at all. Once the doctor hasn't or the midwife hasn't put any restrictions on them as regards sexual intercourse, there shouldn't be a problem.
Right. So if there's offside during pregnancy when it comes to sex or intercourse, your doc will indicate. If you're arguing about it at home, just ask your doc, and he has the red card and the yellow card. What causes some women to crave more sex during pregnancy? Dede has arrived. Dede, we greet you. Some women to crave more sex during pregnancy. Emphasis on some women. Is there anything like that?
Well, yes. I mean, we are all different people, and some people may have different feelings at different times. And pregnancy is a good time to have increased libido because there it is more hormones going on. There's more blood flow to the genitalia. So why not? And if there's also more attention by the husband and so on, there may be more interest and desire in sexual intercourse. But also it goes totally the other way, where a number of women are totally averse to sexual intercourse during pregnancy. So it really depends on also the desire and the will of the woman as well.
Right.
Very important.
Greetings, Mr. Nortey Dua and Dr. Michael McCarthy and Ultimate Health Team. Please, what are the effects of pregnancy-induced hypertension on babies and mother? Thank you and God bless. Pass Solo in Sunyain. Another whole topic in itself, but your comments.
Yes, again, I mean, I'm sure he's asking this question in the context of our discussion on multiple pregnancy about pregnancy-induced hypertension. It is more common in multiple pregnancies.
Right.
So multiple pregnancies are more
You
at
mentioned
risk
that earlier, yeah.
of getting a pregnancy-induced hypertension with all its complications, all its problems, maybe even double the problems,
Okay.
because now you have 2 placentas that could have abruption and so on.
Right.
So bigger problems here. Already you are getting swelling because of the increased load that one is carrying, and the pregnancy-induced hypertension comes in to make that swelling worse. And so it becomes a much bigger problem in pregnancy than if it was a singleton. And so, yes, drawing our attention to this, that monitoring of the blood pressure is probably exceptionally important in the multiple gestation, even more so as compared to the single, though both are extremely important.
Pasolo, you're spot on, right? Okay,
Yes.
As important as weight gain is in pregnancy, in our part of the world, is it not mostly due to the high carbohydrate foods we eat?
Excellent diet question again. So we
Jesse,
are not only
Jesse in Sakumono sent that. Right?
Jesse.
Yeah.
We are not only looking at weight gain. We are looking at quality as well, because the fetuses require protein, they require lipids, that's fat, they require the vitamins and so on. And so the diet should not just be carbohydrate.
Okay.
We're also looking at increasing protein, and so the diet must look at increasing protein. It could be plant protein, animal protein, mixture of it.
Right.
And then of course the vitamins are extremely important. Supplementation with iron is also important.
Right.
So I'm happy that the people are understanding now that what is going in terms of the diet is important.
Okay.
And of course more so with multiple pregnancies.
Great.
Yes.
All right. Food we eat, does it have any impact or effects on multiple pregnancy? I think we've covered that.
Yes, I mean, like I
Hayford
just said, that's
Imbato.
extremely
Yeah.
important. Yeah, the diet is extremely, to the point where the dietitian must come in.
Okie dokie. Please, what causes pain in the legs during pregnancy, or is there muscle pull in pregnancy?
Yes,
Thanks.
the muscle pulls in pregnancy. Shout out to all the women who get the muscle pull during pregnancy. It's a challenge.
Okay.
And it's very uncomfortable, and it's very challenging. So some increasing your activity during the day, some physiotherapy exercises during the daytime, during the time just before bed, can actually help to reduce or eliminate some of these cramps, especially those that occur at night.
Okie dokie. About 9 minutes to touch down or touch out time on Ultimate Health. Join 99.7 FM. We're still managing multiple births, twins, triplets, and beyond with Dr. Michael McCarthy of the Sinal Specialist Family Hospital in Tema Community 6. Any questions, concerns, you can squeeze them in on WhatsApp 055 11 11 997. We're live on Facebook and YouTube, and you can call us in the studio direct 030 221 6541. You might just make it. We got about 9 minutes to go. Right. So we've understood all of these things. In the build-up or the prep to, should I say, subsequent labor or subsequent labor and so on and so forth. Is there anything else that is significant or of concern that I may not have asked? We are talking about managing labor and delivery, but we've been building up steadily. Is there anything that we've left out that maybe we need to talk about?
Yes. So a major part of the antenatal period really has also to do with planning the delivery. Planning for the delivery.
Right.
What is going to happen? How are we going to deliver? What is our plan? What is the safest way to deliver? When should we deliver?
Right.
And yes, the medical people, we have our opinion on what we should do.
Okay.
But a lot of it also lies with the couple, the pregnant woman and her husband, and what are their desires as well. And so planning how the delivery should be, because you want to have a safe delivery.
Right.
And for twins, or other forms of multiple gestation, you need to plan the delivery even more carefully.
Right.
Because now you have to consider the two babies concerned, plus the mother, and all the other obstetric factors as well. So planning there is
planning,
important.
right?
Yes.
You've brought up the things I'd put down in my mind before the program. Planning was something I found very fascinating, right? I discovered something called vaginal birth after cesarean, right? And so on, many other things, right? I was fascinated because, listeners, you may think that, okay, everything's going to happen vaginally, right? If there's such a word. It sounds awkward in my mouth now, right? But if, you have multiple pregnancies, is it expected that you do all this by pushing through the exit doors, right? As so to speak, right? Or is there a higher or a heightened likelihood that there may need to be an intervention or a cesarean and so on and so forth, right? And there were a whole list of considerations that influence and determine the planning of the birth and the delivery.
Exactly.
Right? And who should be there and what is needed and so on and so forth. Right? And I had this in my head and I'm glad you brought it up, Doc. So these kinds of things. So a doctor might decide based on all the evidence available that this has to be done this way. Right?
Yes.
And you're suggesting to me that you need to consult with the couple
as well, yes.
So that there's some agreement as to why we are going this way or that way.
The couple must always be on board with your plan.
Right.
If you have a plan and the couple is not happy with your plan, is not on board with your plan, it's a recipe for problems.
Right.
So you need to find ways
to
get the couple to, buy into the plan and cooperate with the plan.
Gosh, we've got work to do.
Yes.
We should have left it here and done something else. But we said we're doing birth. So, yeah, we got about 5 minutes more. Hello, Nortey. Can the umbilical cord cause harm to a baby? Our baby stopped kicking one morning and we hurried to the clinic to check. The nurse said all is well, but we have to follow up, or we followed up to a different hospital the following day, only to be told that there is no heartbeat. Oh, dear. And that the umbilical cord has tied around the baby's neck. I think we lost the baby. My condolences, Ernest, in Abeka. Yeah. Right. So he's trying to find out, is this a big problem? They responded to it, went to hospital, and they were told things were A-okay, but it turned out not to be so, and they lost the pregnancy, or they lost the baby.
Yeah, this is a very sad one. My condolences to Ernest of Abeka.
Right.
And this is a very distressing situation.
Mm-hmm.
And one would wish that, this would not even happen.
Right.
But it did happen, and that's because we have some challenges with the umbilical cord sometimes.
Right.
There may be actually a knot in the umbilical cord, and that could be a problem. Or it could be wound tightly around the body part. It could be around the neck. It could be around the leg or the arm.
Right.
And that can give a problem.
Right.
And this is typically what happens. The baby is fine for a while, and then at a point,
it can change.
There is a problem.
Right.
And then you go into see that it's the umbilical cord. It's not a very common issue for it to be the umbilical cord, but that could be a point where the problems come.
And that's why we've been emphasizing good monitoring of this pregnancy.
Yes, this one too is a challenge, Nortey, because this was described to be happening outside of labor.
Okay.
It was just a normal day in the life of the pregnant woman, and then this happens, and that becomes very difficult to preempt because of the sudden nature.
So you may have had an ultrasound or any imaging.
Everything would have been normal,
everything was fine.
And then shortly after, things go haywire. So and that's a very sad and difficult one.
Right.
Yes.
Is pregnancy-induced high blood pressure the same as preeclampsia? I had a friend who had to be induced to deliver at 25 weeks due to that. Heard it's deadly. This is from Dede in Maryland.
It is deadly. Preeclampsia, which is high blood pressure in pregnancy with some features, is deadly. It can be deadly for the fetus or the baby. It can be deadly for the mother. And so sometimes, especially in this case, as she mentioned, the baby had to be delivered at 25 weeks.
Right.
Not at 25 weeks is a very, very small baby.
Right.
And the chances of survival are actually very low.
Yep.
And so having to end the pregnancy at that point means that the woman was really in danger.
Right.
From the disease that they did mention.
Okie dokie. We're almost out of time. So, Ultimate Health. So, what happens in the districts and rural areas where ultrasounds are not available? Are the risks higher for multiple pregnancies, or the gynecologist is taught how to cope in the absence of the sophisticated equipment? This is from Na Inosu.
Yeah, very good question. And so Ghana Health Service does a great job in ensuring that a lot of these things are available as far as possible. Also, she mentioned qualified personnel, midwives, doctors, and obstetricians are able to diagnose multiple pregnancies without the use of an ultrasound. Of course, the ultrasound becomes much more accurate, much more earlier, and also is able to delineate what the issue is. But it's not only the high tech that helps. There are other ways to diagnose a multiple gestation or multiple pregnancy.
Okay.
And that can still be done, yes.
All right. So we're out of time, but Doc, there's a lot we need to talk about. Right?
Yeah, we still need to talk about delivery. So how do we deliver these babies?
How do we deliver these babies? This is not something you do or give to DHL, right? Delivered by hands and legs, right? There's a lot that goes into this, and a
whole lot
that can also put a spanner in the planned delivery.
Yeah.
Right?
Exactly.
And there's all sorts of things, whether you have resuscitation, whether you have blood, whether you have this and that and that and that. And I'm sitting here as a lame presenter, but I've got headaches already. So you know, and you can predict the kind of stuff Doc McCarthy and his multidisciplinary colleagues have to go through to make sure not only that we have a viable, safe labor and delivery, but the mother is safe as well. You have, several people in your hands, so to speak, when you're planning all this and when you're executing it. And so we've got to look forward to those discussions with you, hopefully in the following weeks, where we can now lay out what is required, what is necessary, what could go wrong, what have we anticipated and prepared for. Because in certain cases, people think, oh, well, this is not necessary. I delivered before, we didn't have all this. But your doctor or your obstetrician can say, we actually need this, and we will go ahead and make sure it's provided. Right? So, Doc, we have a lot to talk about in the coming weeks.
Yes, there's a lot still to talk about.
Fascinating.
A few more things to discuss, especially the delivery and then how to take care of the babies afterwards and some of the unique challenges that could occur.
Wow. Many thanks to you, Dr. Michael McCarthy.
You're welcome. Thank you also.
I am overwhelmed. I'm thanking you, but I'm overwhelmed because some of the things are just amazing. Let's say you've got 3. And the timing, you take this one out, is the other one okay? I hear the conditions in the womb can change after you've taken one out.
Yes,
right.
Yes.
It even gets smaller. I read
exactly.
And so, how do you time all these things and get it all done? All we hear is that so and so has delivered triplets, and life goes on.
It's exciting.
It's exciting, huh? Well, it's work. It brings to mind Joyce Bawamutari, my good friend. Many of you know her politically as the, I think, still special aide to the former president, John Mahama. Okay. She had triplets 2 years ago. I think they were recently 2 years old. Triplets.
Congrats to her.
Yeah, Joyce. Charlie. Can't be easy, but it was done by his grace. Doc, we salute you.
Thank
we
you.
look forward to having you.
Salute you also.
Oh, yeah. Me, I receive salute, but this one, Charlie, is beyond me. It's beyond me. You're doing great work alongside other health personnel and professionals in this country. Right, stick and stay on Joy 99.7 FM. Another, hopefully easy to digest program. Produced by Abeku Kofi. Me, I just talk. My name is Nortey by nature. Stick and stay on Joy 99.7 FM.